My name is Paul Kidwell, and I'm here representing the Connecticut Hospital Association this afternoon. Thanks for the time. I'm going to reserve my comments for SB 11. My colleague Mark Schaefer will be here later this afternoon to speak on HB 7191. We support many of the provisions of SB 11, but want to reserve my comments to sections 17 and 18 of the legislation related to 340B. CHA supports Section 18 of the legislation, but asks that the definition of covered entity in Section 17 be amended to reflect the federal definition of covered entity in Section 340B-A4 of the Public Health Service Act, rather than the bill-specific definition that excludes hospitals. Under federal rules, 340B covered entities, which include hospitals, are allowed to contract with one or more pharmacies to provide pharmacy services and 340B drugs to authorized patients. There are comprehensive federal guidelines and audit and registration requirements that govern a covered entity's use of contracted pharmacies. Pharmaceutical manufacturers have sought to undermine and impede covered entities' use of contract pharmacies in contravention of federal guidelines and advice. These actions have been to the detriment of hospital patients and the communities hospitals serve, lessening the benefit of the 340B program, which is used to support the unreimbursed care for low-income Medicaid beneficiaries, uncompensated care, and the community investments hospitals provide each year. Unfortunately, hospitals and the patients and the communities they serve would not benefit from the protections in Section 18 because the definition in Section 17 of covered entity excludes hospitals except for the Yukon Health Center. In 2023, hospitals in Connecticut provided more than $270 million in uncompensated care and were underpaid for care provided to Medicaid beneficiaries by $1.4 billion. Access to the 340B program is a core part of supporting care for the community and for continued community investments. Without this change, we are concerned that by enshrining protections for only certain covered entities, the legislature is implicitly authorizing discriminatory practices against hospitals, something that we don't believe is the legislature's intent, but which could be the ultimate result. We appreciate your time this afternoon. Happy to answer any questions.
Great. Thank you so much. Don't see any questions. Thank you for your testimony.
Thank you very much.